Can a chiropractor fix a herniated disc? This is a fabulous question, and I'm excited to go over this one with you. So we typed this question into Google. I want to read to you what the answer is. So, to treat a herniated disc, your chiropractor will develop a treatment plan that may include spinal manipulation, also known as adjustments, and other chiropractic techniques to help ease your herniated disc symptoms. So, the thing about chiropractic is, do we do adjustments? Sure. It doesn't necessarily mean that that's the only thing that we have in our toolbox. Here at Performance Place, we actually find, especially with herniated discs, that the chiropractic adjustment is not always necessary. Massage itself also is not always necessary. A lot of times what it comes down to is educating you on the movements that is causing your pain in the first place, finding that movement through watching you do certain things that you are noticing is causing your pain, and then just advising you on doing something other than what's going to cause pain. So for example, when we go through certain movements such as flexion, and I'm going to show you here on the spine model, we have our little vertebra here, and these are our low back vertebrae, discs, and nerves, okay? And so I'm going to zoom in on this little area and show you what could be causing your pain in the first place. And so I'm going to take up my little spine model here. It's going to be the same thing that you're seeing here, just kind of zoomed in. And so what we see is this is the front side of the body. This is the back side of the body, okay? And what we find a lot of times in office is that flexion is causing injury to the discs and nerves in the low back here. So as you'll see, as I apply some flexion and some compression on these discs, you see this little jelly material here pressing on the nerve in this area. And so when people come in office and they start to tell us, I don't know why I'm having pain with this specific movement, when I'm doing deadlifts, when I'm in the gym, when I'm tying my shoe, when I'm getting up from a seated position, when I'm getting up out of bed in the morning. Things of that sort all have one thing in common, and it's usually flexion. So in office, we just have people show us what's causing their pain. That's the one thing that we pick up on. And all we really do is just give them one specific movement that can get them out of pain. And a lot of times what happens is we take them from a flexed position to extended position, and it actually helps relieve a lot of their pain. That's without us even having to put our hands on them. That's without us having to massage them. That's without us having to adjust them. Not that these things aren't necessary or that they wouldn't also help, but with the time that we're in right now, and us having to socially distance ourselves with the COVID-19 going around, we want to make sure that we can meet you where you're at, and we want to still help you. Disc herniation can still occur, although we're being required to stay at home or not go into offices or anything of that sort. So we can virtually manage you. We can go do a video call and see if we can explain to you and educate you on certain things that could be causing your pain. And then we'll just give you this extension movement and certain exercises over camera or video call, and see if this is what's going to help you. So if this is something that you're interested in, you just have to give us a call here at Performance Place Chiropractic. We're located in Huntington Beach, California. We'd love to see if there's a way that we can help you from a distance. So please give us a call.